You just can't not pay people.
Our investigation into problems at Renova hospitals.
I don't know how they're staying open. I really don't.
Now with a new warning.
I just don't want to see anybody get hurt.
A former manager at the Big South Fork Medical Center says the Oneida Hospital was double billing its patients.
They were getting people to work 24-hour shifts.
And ran out of basic supplies for life-saving tests.
I just can't in good conscience sit there and see that happen.
10 News reporter Cole Sullivan continues our investigation.
You have, what, 50-some years of experience in hospitals.
Right. That's correct.
Have you ever seen anything like that before?
No. We wasn't able to take care of the patients like we needed to. We couldn't provide them the services that they needed. And this just kept getting worse and worse and worse.
For more than a year and a half, David Wilkerson worked as a lab manager at Renova's Big South Fork Medical Center in Oneida. He says the hospital regularly ran out of supplies his staff needed to run routine lab tests. Tests like a complete blood count or CBC panel.
He's been in a car wreck or something. You need to know how much he's bleeding. That's going to tell them. That'll let them know how much blood they're going to need to give him, or if they need to give them a unit of blood.
The hospital ran out of that test to see how much blood they might need to give a patient.
Yes.
He says Big South Fork relied on other hospitals to analyze its samples.
If you got a patient sitting there that's bleeding, 2 hours is a long time.
And when they sent tests out, Wilkerson says Renova double charged patients.
Essentially, you're billing them for the panel, which included that test to start with that you couldn't run, and then you're billing them for the test separately.
He says employees were impacted too.
How often do people have to work 24-hour shifts?
Before I left, it happened 6 times. That can be very bad in the lab. You could kill that patient.
He says he told managers about the problems, but it did not change. Eventually, he quit.
I just can't, in good conscience, sit there and see that happen.
Now he's worried Scott County, where people need a hospital, does not have one that can properly take care of them.
I'd hate to take my chances and go in over there if I was in an accident or really sick. I think I'd just have to tell that ambulance driver to take me on to Knoxville or someplace else.
And Cole, that manager's making a lot of accusations. You ran down part of his story.
Yeah, and we've confirmed a lot of what he says with another employee who worked there. Obviously, we've got a lot more questions and unfortunately not a lot of answers. We've asked for comment from Renova. That's the hospital, the company that owns the hospital. I've also left a message for the person in charge of their Oneida facility, but we've got no answer from either. The mayors of Scott County and Oneida haven't responded, and the Department of Health says it does not comment on allegations. We would not have known about this story without viewers giving us a heads up. You can send us story tips at 10listens@wbir.com or call that number on your screen, and we really do appreciate your help.
Cole, we appreciate your reporting, and we'll continue it. Thank you.